Hello everyone, welcome back to Simplify Cancer. This is Dr. Raghu Vamsi and I am here to simplify your understanding about cancer. In today's KYC series, we discuss about stomach cancer. Stomach cancer is the second most common cause of death from cancers worldwide, and November has been considered as a stomach cancer awareness month. It is more commonly a disease seen in developed countries in Asia like in Japan, China and South Korea. Even in India, the incidence of stomach cancer is quite high in some states like Mizoram and other northeastern states, and also in the southern state, especially in Andhra and Telangana. And this has been attributed primarily to the dietary factors. There is a tendency to eat salted foods, especially in the form of pickles or very spicy chutneys, the biryani, fried rice, etc. The other common dietary factors include smoked meat, dried fish, any processed food, and other kinds of spicy or chili food. Other than this, smoking or any form of tobacco and alcohol is also quite prevalent in these areas. All these factors added together increased risk of stomach cancer in these areas. Obesity and reflux disease, they have an increased incidence of stomach cancer. Stomach cancer is known to run in families in some kinds of syndromes where there are some genetic changes like Hereditary Diffuse Gastric Cancer Syndrome, FAP, HNPCC, and Hereditary Breast and Ovarian Cancer Syndromes. There are no specific symptoms which will help us identify stomach cancer, especially in early stages, because most of the patients have very vague symptoms like indigestion or bloating or feeling of fullness even on consuming small quantities of food. Sometimes they may have a sensation of burning in their stomach, which usually is colloquially diagnosed as an ulcer problem, and people tend to take medications over the counter for the same. So the point to catch here remains, whenever we have any symptoms like these which are quite vague, be it bloating or any form of indigestion or what we commonly call as ulcer problems, even after taking medication for a period of 1 month or so, if there is no improvement in symptoms, or even after improvement, if anyone has a tendency of developing the same symptoms again, it is ideal to get tested. Preferably get an endoscopy from a specialist gastroenterologist, and then based on their findings, treatment will be planned. Another important factor we have to know is a Helicobacter pylori infection, which is a bacterial infection which may cause the similar symptoms. In that situation, along with the ulcer, treatment for the Helicobacter pylori infection also reduces these symptoms. Other late-stage symptoms may include distension of the abdomen, loss of appetite, loss of weight, feeling of a mass in the abdomen. So we need to remember, anyone beyond the age of 40 years, if they have these symptoms like bloating or some kind of fullness or indigestion, they need to be investigated if the treatment does not improve their symptoms within 1 month. 1 month after any form of treatment, if you continue to have the symptoms or are having these symptoms repeatedly over a prolonged period of time, it is ideal to get an endoscopy done. In the next video, I'll be discussing the investigations and the treatments available for stomach cancer. See you next week. Take care.